Okay, so we've had a look at the central vein on a nice example case, and I've shown you a few lesions which I think were central vein sign positive. But what I'd like to do now is drill down a little bit more into the process of selecting lesions for evaluation and the actual criteria that we need to apply for deciding whether a lesion is vein positive or negative. There are a number of considerations here. The first thing is we need to be looking at lesions above a certain size. So if a lesion is less than 3 millimeters in all three planes, it's not eligible. So it needs to be more than 3 millimeters in at least one plane. So we've got a few tiny little dot-like lesions around and about which we are not going to be considering in our evaluation. But most of the lesions that we can see here, and I think some of them I already highlighted earlier, are more than 3 millimeters in at least one plane. So these are all lesions that we think are eligible. When we're looking for the central vein, what we want to see is that we can see the vein enter the lesion and then run centrally through the lesion. A vein that runs along the edge of a lesion or just glances off it isn't considered eligible. It needs to be central within the lesion. And so we've got a couple of nice examples here. Again, I think these are ones that are mentioned briefly earlier, where we can see that the vein is central within the lesion there. And the vein itself needs to be less than 2 millimeters in diameter. I don't normally measure these. I think you can sort of eyeball it, but if we look here, for example, this vein is 1 millimeter in diameter. Quite a prominent vein, like the one we've got on this lesion here, is still only 1 millimeter or so in size. So we're really limiting it to the fine, delicate vessels running through the parenchyma, but most of the lesions that we've seen here that fulfill that criteria. There are a couple of other things we need to look for. If we have a large confluent lesion, so I'm just going to move back here, so may be able to find a better example than this, but where we've got a lesion, for example, this lesion here, periventricular lesion, we can see it tucked in here. We can actually see that there's a number of veins running through the lesion. And we're really looking for a single central vein. When you've got a larger lesion with multiple veins running through it, that also doesn't fulfill the criteria. And obviously in some patients with really quite advanced disease, you'll have large areas of T2 hyperintensity in the periventricular white matter. And in those cases, sometimes it can be quite difficult, in my experience, to identify a clear, discrete lesion with a single vein running through it. And that can be a problem, actually, when we use this technique to try and differentiate MS from people with ischemic small vessel disease, particularly in people who are slightly later on in life, where there is confluent disease, but we sometimes struggle to see a discrete lesion with central vein, or certainly struggle to see enough discrete lesions with central veins to confidently make the diagnosis. But it can still, in those cases, on occasions, be quite useful if you happen to be lucky and can see those discrete lesions.